Life moves fast, and so should the answers to your biggest questions. Welcome to Endo Batteries Quick Connect, your direct line to expert insights. Short, powerful, and right to the point. You send in the questions, I bring in the experts, and in just 5 minutes, you get the knowledge you need. No long episodes, no extra time needed. And just remember, expert opinions shared here are for general information and not for personalized medical advice. Always consult your provider for your case-specific guidance. Got a question? Send it in, and let's quickly get you the answers. I'm your host, Alana, and it's time to connect. Today, I'm honored to welcome two incredible physicians, both whom bring unique expertise and deep commitment to caring for patients with complex conditions. First, we have Dr. Zach Spiritos, a neurogastroenterologist and internist. Dr. Spiritos trained at UNC School of Medicine, completed his residency at internal medicine at Emory University, and went on to a fellowship in gastroenterology at Duke. He specializes in a wide range of gastrointestinal and liver disorders, with particular interest in irritable bowel syndrome, functional abdominal pain, motility disorders, and dysautonomia, including conditions like POTS and mast cell activation syndrome. He also has expertise in GI complications connected to hypermobility syndromes like Ehlers-Danlos. Also joining us today is Dr. Vincent Obius, a professor of surgery and chief of the Division of Colorectal Surgery for the National Capital Region. Dr. Obius trained at the Medical College of Virginia, Eastern Virginia Medical School, and Cleveland Clinic, with additional advanced training in laparoscopic colorectal surgery at University Hospital's Case Medical Center. He is double board certified in general and colorectal surgery, and his specialties include robotic minimally invasive techniques, as well as surgery for deep infiltrating endometriosis. His research and clinical work have made a lasting impact, particularly in robotic surgery outcomes and complex endometriosis care. Together, these two doctors bring insights from both the gastrointestinal and surgical perspectives, making today's conversation one that promises to be both informative and empowering for patients and providers alike. Please help me in welcoming Dr. Zach Spiritos and Dr. Vincent Obius to the table. Vince, have you experienced that? You've done resections and you've been in surgeries where they've had multiple surgeries. They continue having these symptoms. Is it typically disease state that you're seeing again, or is it something else completely?
Yeah, I will say that every time I'm in a case, especially now working with Dr. Vargas and Dr. McHale, their success rates in finding nodules and involvement of the bowel is like 100%. So whenever, and like we had mentioned and discussed earlier, sadly, most of the surgeries I'm involved, there's been previous surgery, it's just sad to see. Honestly, the gynecologist did the right thing. Rather than tackle this complex nodule on the rectum and have a complication that's just terrible, don't do anything, document it, get it to an expert. But yeah, I mean, when they're having post-surgical, and there's usually because of endometriosis that's been left behind, sometimes inadvertently and regrown, and sometimes they knew it and they're like, look, I'm not gonna risk it. And it's the smart thing to do. Understanding that, they're a little bit out of their element. The patient is not aware a big surgery can happen. And it's better to just, get out, let them recover quickly. But it's very frustrating, honestly, for the patients who are like, they came in, they're hoping to have one procedure, they're hoping to have this done, taken care of. And they've been told not only that, we're doing this, but there's going to be, we couldn't do it all, but there's also a worse situation and you may need even more advanced, extensive stuff. So yes, I absolutely have seen it. And the majority of the time it's because of there's endometriosis being there.
Okay. Yeah. I think that's probably pretty common with people that I hear, including my own story of disease being left behind. But that goes to say that that's why this education is so important, right? And we have to keep educating about this. Zach, is there an ideal pre and post-operative routine or things that we can do to help support us from the mast cell part of it? Because I know a lot of people, including myself coming out of it, things flare really bad. How do we help alleviate a little bit of that pre and post-operatively?
Yes, we want to make sure their mast cell is under as best control as possible pre-operatively. I tend to reach out to the surgeon to discuss the case and just say, hey, this is how I would think about this specific patient, whether they're hypermobile and they need a neck brace during a surgery because they have a lot of craniocervical instability. Do they have POTS and just need do they really need to be fluid resuscitated before the case and really just make sure that they're adequately hydrated? If they have mast cell activation syndrome, there's certain anesthetics that tend to flare mast cells and postoperative narcotics like morphine that tend to be more aggravating for mast cells. And there's also a dialogue like what happens if they have a huge flare and go into anaphylactic shock? Like we should probably have like steroids and, H1 and H2 blockers ready to go in case that happens. And so I have a protocol that, I've written with I haven't written, but I've adopted from other mast cell clinicians. And I often will reach out to the surgical team and say, this is kind of what I would do and how I would approach this patient kind of perioperatively and intraoperatively just to get the best outcomes.
Yeah.
Yeah. Honestly, like the way Zach pointed out, it's important to emphasize that when you're dealing with something like endometriosis that can affect so many different areas, colon, rectum, diaphragm, bowel, bladder, it's multidisciplinary. Just like when I deal with rectal cancer, we have radiologists, oncologists, radiation oncologists. We have a variety of people on the team to discuss it. And so endometriosis, especially complex stuff, is starting to lean that way, where you have multidisciplinary teams talking about it so that we don't miss things. As Zach pointed out.
That's a wrap for this Quick Connect. I hope today's insights helped you move forward with more clarity and confidence. Do you have more questions? Keep them coming. Send them in, and I'll bring you the expert answers. You can send them in by using the link in the top of the description of this podcast episode or by emailing contact@endobattery.com or visiting the endobattery.com contact page. Until next time, keep feeling empowered through knowledge.